My name is Dr. Rayhan Hadri. I'm a consultant gastroenterologist, interventional endoscopist, and also the clinical lead of endoscopy here at Cleveland Clinic London. When a patient experiences reflux issues, essentially what is happening is the contents of their stomach, such as bile, acid, or even food content, are refluxing back up into their esophagus. And this can manifest with a number of conditions and a number of symptoms. Two of the most common conditions that I will see related to reflux in my clinic are gastro-oesophageal reflux disease, or GORD, and laryngopharyngeal reflux, or LPR, or sometimes even referred to as silent reflux. Patients with gastro-oesophageal reflux disease will often experience symptoms such as heartburn, chest discomfort, a sour or bitter taste in their throat, but also other symptoms such as a cough or a sore throat. Often these symptoms will be quite debilitating and impact on their quality of life, and in most cases can be managed with conservative lifestyle measures, over-the-counter medication such as antacids, but in extreme scenarios patients will need long-term medication or a discussion around surgical or endoscopic correction. Patients with laryngopharyngeal reflux, or often referred to as silent reflux, will often present with quite chronic and debilitating symptoms such as a sore throat, a lump in their throat when they swallow, also referred to as globus, or even a change in their voice. In these patients, it can be very difficult to make the diagnosis, and often the therapeutic interventions are also limited. As a gastroenterologist, one of the most common complaints my patients will come to me with is acid reflux. In the majority of patients, this is nothing to worry about, but in some patients where this acid reflux and the symptoms are persistent, my concern is the potential damage it is doing to their esophagus. Some patients will require long-term medication, and as a result, they are less enthusiastic about taking PPI drugs on a long-term basis. This is for a variety of reasons, including some of the side effects that have been described of these drugs. And so we're in a unique position here that we can offer them minimally invasive alternatives, such as endoscopic therapies for reflux. We offer transoral incisionless fundoplication as an alternative to surgery to reduce reflux symptoms and stop the use of these drugs in the long term. In patients with acid reflux symptoms that are persistent, the first line of management is conservative measures, and this will be lifestyle modifications such as moderating the amount of coffee, alcohol in their diet, by stopping smoking, but also by moderating and reducing their weight. If despite this they remain symptomatic, then simple over-the-counter agents such as Gaviscon or Pepto-Bismol can be used. These work very simply by temporarily neutralizing the acid in the stomach and therefore reducing the symptoms of acid reflux. If despite these conservative measures patients continue to have symptoms, then we prescribe medications. And these medications referred to as proton pump inhibitors. And what these drugs do is they actually reduce the amount of acid that the stomach makes, and therefore reducing the amount of acid that can reflux back up into the esophagus and reducing the symptoms of acid reflux. However, as successful as this surgery is in the majority of patients, it does have drawbacks. In 10 to 15% of patients, they will experience problems swallowing after the operation, the inability to vomit or to expel air. And as a result, patients are less enthusiastic about pursuing this option and will want to look for alternatives. At Cleveland Clinic London, we're very privileged to be the only centre in the UK offering patients an alternative to surgery for persistent and troublesome acid reflux. This is a minimally invasive endoscopic procedure that is called TIF. TIF stands for transoral incisionless fundoplication. TIF is a minimally invasive alternative to the surgical procedure for acid reflux. It is a procedure that takes no more than 30 to 45 minutes and is completely scar-free. It is carried out under general anaesthetic, often as a day case, and involves passing a camera or an endoscope through the mouth into the esophagus. Over the camera we insert a special device that allows us to carry out the TIF procedure, and with a series of plastic staples that we apply to the bottom of the esophagus, we're able to recreate and strengthen that valve and stop acid reflux in up to 85% of patients. In patients that are eligible for TIF, the recovery period after the procedure is very smooth. It is a very safe procedure and the risk of an adverse event is less than 0.5%. The success is in the region of 80%, and this is important because up to 80% of patients will have an improvement in their acid reflux symptoms, but also will be able to stop and discontinue their acid reflux medications. For further information on acid reflux, Barrett's esophagus or TIF, please visit the website or visit the inquiries page to get in touch.